Well, with us right now from 7-Day Dental, our Dr. Christine Chung. Also, John Chandra is here today. Good to see you both, as always. Happy holidays to you. Good morning to you. We are going to talk about a couple different things. You sent us a slide over about veneers, am I right?
Yes.
So, first, here's a kind of a before and after thing. I want you to tell us what veneers are, why would somebody choose these, and how are they different than maybe, I don't know, crowns or something else?
Right, good questions. So we start with the slide. This patient, he's in his early 30s. Actually, I'm sorry, I don't have a very picture of before, way before he came in. He got crooked teeth and unproportional sized teeth. As you can see, the two central teeth are not proportionally sized.
Right.
So what we did was we give him 12 months of braces.
Okay.
Straighten the teeth, and still that small space in between, we did the veneer, and veneers are very minimally reduced size of the enamel.
Okay.
We don't really grind down the whole tooth structure. It's just the facial aspect of the tooth, and then it's like a thinner jacket that we bond over the tooth.
Okay.
And that we were able to cover the space. It's called diastema, and the patient is so happy. Look at the before and after. I mean, we give him a perfect smile. That's what he always wished to have all his life. He's 30s, in the early 30s, and he was so appreciative, and he said, I couldn't thank you enough because you give me the smile that I want. Compared to when he came in, it was all crooked, space all over. So we will manage to close all the space in the back, just a little bit space still in the middle. But because of his unproportional size of the two teeth, we were able to close that gap and also to make the teeth a little bit longer so that it's more proportional to his face.
So let me ask you, does the veneer wrap completely around the tooth or just the front?
Well, it depends. We can have a partial veneer, which is just wrap around the front and a little bit in the back, or a full porcelain, and that is depending on the cases.
Okay.
Let's say if the patient has severely decayed tooth, we have to remove all the decay. Sometimes we have to fully crown or veneer that tooth. Yes.
Okay.
And it's full porcelain, so it's very natural, and it's like a tooth structure, your own tooth.
Okay, so the patient isn't going to, once they get these on, they're not going to feel anything different.
No.
You know, like the back of the tooth, a little crease or something.
No. Yeah, we make sure that it's all flush and smooth and everything before the patient leaves. So.
And they last for how long?
Well, anything, we don't want to guarantee a lifetime, but on the average, any crowns, any restoration, it should last 5 years.
Okay.
But I have patients have veneers and crowns last them 10, 20 years, depending on how they would take care of it.
Okay.
You know, it's wear and tear. Sometimes they wear it and they bite on a fork or a bone and they chip it. I mean, you chip your teeth, you can chip your porcelain. Exactly. Yeah, so it's dependent on the patient lifestyle too. Yeah.
Let's talk about just in general periodontal disease, and it's something, you know, I've heard that almost all of us have at one point or another.
Yeah, so early signs of periodontal disease or gum disease would be bleeding. I mean, when you brush and floss, if you find minimal bleeding, it's normal, but when you see quite often that happens and a little bit more bleeding than you should see, that's an early signs of gum disease.
Okay.
And why is that? It's because you have plaque buildup. And where does the plaque coming from? It's from your food. So after you eat, bacteria start to build up around the gum, your teeth. And if you don't brush well, you don't floss well, it takes about 24 hours for the plaque to get calcified. And once they get calcified, it becomes harder. That's why you call calculus.
Okay.
And when it's so hard, a normal toothbrush or flossing you won't be able to remove all that. So it's kind of like a hit and miss where patients they think that they don't have to go to the dentist when they say they think it's normal. But actually, I would recommend or advise patients if there's any abnormal that you find because it's in your mouth, you should know. Seek the dentist. Early signs of gum disease is bleeding, bad breath, and then all that will eventually lead to tooth loss because you would lose all the bone and the periodontal ligaments, which is the attached tooth to the bone.
Right, exactly.
Yeah. So those are the early signs. So should you see a dentist when you have bleeding?
Right.
That's the first sign that you see.
Okay, makes a lot of sense.
Yeah.
So you get that, what's it, the calculus? And
Calculus all removed. Yeah. So when you go to the dentist, we do a very thorough exam. We would do X-rays and check how your bone level is at current. And we measure the pockets to see if you have any periodontal pockets. Pockets are very important because for healthy teeth, your pockets should be 1, 2, or 3. But if you hear
And we're talking about the space between the gum and the
and the
tooth.
bone, yeah.
Yeah.
When they use the instruments
Right.
and measure, and then the dentist will call out 2, 3, 4,
Right.
5, 6, and the assistant would sit there and chart or record the numbers. The bigger the numbers, the worse it gets. Because when you have deep pockets, that means that every time you eat, food will deposit on those pockets. And there's no way you can brush underneath those pockets when you have 5, 6 millimeters. The toothbrush
Right.
is just too big.
Right.
So with us, dentists or hygienists, we have special tools that we go in, the machine, or it's called Cavitron, and we irrigate at the same time and scale out all these tartars or bacteria, and that will help improve the pockets.
Okay.
When your pocket is eliminated or improved, you have less chance of build up
Right.
those bacteria or tartar on a daily activity, eating and all that.
Very
Yeah.
good. Yeah.
And with those bacteria that cause gum disease also is going to lead to tooth decay. So whenever you have a sensitive tooth, call us.
That's a good point. Yeah.
Yes. Don't wait, because when you have a sensitive tooth, maybe it's an early signs of a decay tooth or a recession of the gum. But if you wait longer, any cavity will get bigger, not smaller. And eventually, from a small filling to a big filling, or maybe you would need a crown, and if it's too big, too deep, you probably end up with a root canal treatment.
Yeah, you don't want that.
You don't want that. So I can't stress enough importance of routine recall, 3 months, 6 months, or even if you just see the dentist within a month and then you start to feel anything
Right.
unusual, bleeding again, sensitive tooth, give us a call.
All right. Now, speaking of someone who is sensitive to maybe helping some of
am
your
sensitive.
patients keeping a little bit of money in their pocket, you've got some nice holiday
We do.
deals.
And you know what? I also want to say that Doctor handles the technical end. My end's so important because I check the pulse of everybody basically on how they feel about their experience with 7-Day
Right.
Dental. And the more information that you can give me, community, I appreciate it. It just helps us be better. So right now we have our 20% normal discount. We have our 5% normal discount for veterans, and we're also showing some kind of Christmas discount.
Yeah, with the holidays, we do give some special promotion. If you come in, we can give free consultation, bleaching at a discounted rate.
Okay.
We also have the monthly drawing going, which we're giving coupons for grocery stores
Great.
to our
Give
patients.
back to the community.
And you can get a hold of me if you want to talk about how we're doing at any of the stores, but you can, our offices, but you can contact our Laguna Woods office and just ask for John, and they'll get it to me, and I'll return
Okay.
the call. And we appreciate you very much here at the community.
Thanks for coming on. And of course, the website on the screen is very easy, 7daydental.com. And the Laguna Hills office is 949-859-3988. Good to see you both.
Excellent.
Thank you for having us.
Thank you for
We'll
having
be
us.
right back.
Thank you.